Hello everybody and welcome to the Tuesday edition of Video Clips. I hope that you had an enjoyable Memorial Day weekend such as it was with all the restrictions, and so we're back to regular programming. I did not send out a newsletter yesterday, so those of you who thought maybe you didn't get it because I didn't send it. Next week will be regular newsletters until the next Monday holiday, which I think is Labor Day. Just continue to get a lot of emails from you guys. I think that most of us are having pretty civil discussions even when we disagree. If you disagree with something, please send me factual information. In other words, screaming at me doesn't help much because screaming at me isn't facts. So, one thing I want to address is that I probably get an email once a week from somebody who says, well, don't you care about 250,000 people dying? I care about one person dying. Just to be clear and for the record, I care about anybody who dies. But public health is not about preventing all deaths. That's the first thing I want to say. Public health is about mitigation, and mitigation means that there is no risk-free option. We tell people that in our office every day. There is no risk-free option. In other words, if you decide to have a screening test, there are risks associated with it. If you decide not to do it, there are risks. If you decide to take a drug, there are side effects. If you decide not to take it and you have a condition that and some people might think you should be drugged for, but the risk-benefit ratio doesn't look so good, there's a risk in not taking the drug. There is no risk-free option here. And to illustrate that point, I looked this up, people screaming at me, there are 250,000 people who've died worldwide. Well, we know that there's been a lot of playing around with the numbers, and I'm going to talk about that in a minute. But 1.3 million people die of car accidents every single year worldwide, 1.3 million. So you might say, I get in a car and drive every day. Don't you care about people dying from car accidents? Why aren't you telling people not to drive? You're setting a bad example by driving. What's the matter with you, lady? I think we can understand that driving is not a risk-free option, and every day adults get in the car, or some teenagers, get in the car and realize that when you drive, you take a risk, and you are willing to accept the risk associated with driving because the benefits outweigh the risks. And so that's what we should be doing in public health. And what's happened here, and I'm going to be talking about it later in the week, is that we have completely lost sight, we, the collective we, not me, not several individual people, but many of our health professionals have completely lost sight of the collateral damage while they're trying to make sure that nobody dies of COVID-19, and there's no way to ensure that, number one. And if we cause 2 or 3 or 10 or 20 times as many deaths on the other side, that's a risk-benefit ratio that makes absolutely no sense in public health, all right? So anyway, the last thing I'll say about this is make sure when you ask me for information that you've looked at the newsletters and read the video, watched the video clips, because a lot of the things you ask about I've already covered, and I'm trying to cover new stuff as it comes up rather than go back over the old stuff. All right, so couple things coming up. Thursday, May 28th is our next free intro workshop, pampopper@msn.com. If you're interested in our free stuff, which also includes a weekly newsletter, free trial membership. We have, and we'll send non-subscribers who become subscribers all the past issues of the newsletter. We don't send them out individually every week. Don't ask us to do that. And then if you're interested in careers, lots of you are thinking about a career change, particularly some of you who are in healthcare. And some of you who aren't in healthcare really want to become part of the solution to all of this nonsense that's going on. So pampopper@msn.com. I'll send you information. Happy to schedule a phone call with you. And summer semester starts next week. The Diet and Lifestyle Intervention course is a magnificent 15-module course that covers everything from basic research to modules that include women's health, men's health, children's health, vaccinations, cancer, autoimmune diseases, gastrointestinal diseases, etc. It's a good overview course. And also dietary intervention in employer and other group settings, food service and institutional settings, psychology, which will include communication, teaching skills, and problem solving. And so lots of stuff going on here. And if you're interested in any of it, send me an email. And of course, I'm interested in your comments. I'm particularly interested in people who want to have a civil discussion. Let's talk about ginning up the COVID death rate. We'll start with Illinois. Some of the most draconian lockdown measures are in Illinois. As it turns out, the numbers used to justify the lockdown are manipulated as per instructions issued by the CDC. On April 20th, 2020, the Illinois Department of Health Director, Dr. Ngozi Ezike, explained how her department decides whether or not a death is due to COVID-19. She said that anyone who dies and has tested positive is categorized as a COVID death. So you get hit by a bus, the trauma kills you, but you're COVID-19 positive. Death certificate says death by COVID. Okay, we call that misrepresentation where I come from. I'm going to read to you verbatim what she said. Quote, if you were in hospice and had already been given a few weeks to live, and then you were also found to have COVID, that would be counted as a COVID death. It means technically, even if you died of a clear alternative cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that was the cause of the death, but they had COVID at the time of the death. So I find that an interesting quote. Those were her words directly. You can go online and read this. So she basically said, whether or not they died of COVID, we're going to count it as a COVID death. So they could have died of something else, but we still put it on the death certificate because in the world of public health in Illinois, telling the truth is obviously not part of the culture there. Even while using falsified death certificates, state health officials acknowledged on April 20th that the number of cases and deaths is decreasing, yet today in late May, the state remains locked down by the Emperor of Illinois, Jay Pritzker. I have some more to say about him later in the week. Colorado State Representative Mark Baisley has asked for a formal investigation into Joe Ryan, Executive Director of the Colorado Department of Public Health and Environment, with the potential for criminal charges to be brought. According to Baisley, Ryan has falsely altered death certificates. This is even one step further than the nitwit in Illinois. Baisley provided a letter from the Summer and Glen Senior Care Facility, which was sent to its staff, residents, and families of residents, stating that the Colorado Public Health Department had changed the cause of death recorded by the attending physicians in 7 cases to reflect COVID-19 instead of the actual cause of death. In other words, in this case, what happened is the Department of Health overrode and actually changed it once a physician had signed off on it. The Montezuma County coroner told the same news station that reported this, that the state overruled the cause of death for a person in his jurisdiction too. The person died of alcohol poisoning, but it was changed to COVID-19. So I guess the deal is that in order to make the numbers sound terrible, we do whatever we have to do, including forgery, falsification, actually changing the thing on the death certificate, the entry. It's pretty incredible. Eventually, the Colorado Department of Health actually acknowledged that the numbers had been inflated by people who had the virus but died of other causes and by falsified death certificates, and adjusted the numbers down from 1,150 deaths to 878. Now, remember Dr. Deborah Birx, who looked into the camera and told everybody to follow the CDC's directions and falsify death certificates? Yeah, her. She's changed her mind about that. Just a few weeks ago, during one of the White House press briefings, she directly said, and there was a fuss about it. I mean, we got calls from doctors who said, I have to do this or lose my job, but I resent being told that I have to lie in order to keep my job. So now she's saying the opposite. She's asked the CDC to exclude from the death count people who had the virus but died of something else, and also to remove those who were presumed to have the virus but did not have confirmed lab results. Birx and other health officials now are taking issue with the CDC's system, claiming that the number of cases and mortality may be inflated by as much as 25%. She said, quote, "There is nothing from the CDC that I can trust." Gosh, she used to love these people. She used to lie for these people. Not surprisingly, the CDC is refusing to alter their numbers. Bob Anderson, chief of mortality statistics branch of the CDC's National Center for Health Statistics, says that the numbers are actually underreported. Well, how can that be? The number of cases includes people who were never confirmed to have COVID, and the number of deaths includes people who died of something else, and he's still going to look into the camera and claim that the deaths are underreported. I mean, it's really kind of amazing. Another person who thinks that the numbers are underreported is Anthony Fauci. Again, what part of this does he not understand, and why does he have a job? And something else I want to point out. I don't know if you've noticed, this is very interesting to me, that over the course of this whole thing, there were a couple of high-profile child deaths, which were the medical examiners in the two states where this happened refused to sign off on as a COVID death. They just refused. The record was never corrected, even after that happened. The governors who made these pronouncements, Pritzker was one, and the nitwit in Connecticut was the other one. And they never corrected the record. They just stopped talking about it. So everybody basically was saying kids aren't affected, and now we're talking about sending kids back to school. And oh my gosh, it is a miracle. And you know, coincidence is just abound in the COVID-19 business. We're starting to see children get sick, right? And we think it might be COVID. So anyway, I will have something to say about that in a future video clip, probably next week. We're looking into it. And part of the problem looking into these issues, to be honest with you, is that there's so much lying and misrepresentation going on that it takes a lot of digging to get to what's actually the truth. You have to peel back layers of people lying. You have to look for somebody who's been lying but is willing to tell the truth, and then you have to document it. So it takes time, but I will get back to you on that. Even the discussion about hot spots of COVID activity aren't accurate when you start digging into how the numbers were developed. Now, I want to report some more on New York State, which is ruled by the Emperor Cuomo. New York State has reported 356,000 cases and 25,083 deaths, and we already know that some of these were erroneously categorized as cases and deaths because the CDC told them to do it. But there's more. Over 4,300 COVID-19 patients who were discharged from hospitals were sent to nursing homes where the most vulnerable population lives, per orders from the Emperor Cuomo. He himself referred to nursing homes as, quote, the optimum feeding ground for this virus, but said the reason he did this was to make sure that there were enough hospital beds for really sick people. Now, this had to be a whole lot better solution than the alternatives, which were A, an empty hospital boat in New York Harbor. I said before, when he was putting them in tents in the parking lots and all that, that is such a better place for patients than hospitals, floating hospitals in New York Harbor. And you certainly do not want to open up closed hospitals. That is a disastrous thing to do when you have overflowing patients, if that's what was really going on. So he made a great public health decision, and great moments in public health is really what we should be talking about every week here, right? And he moves them to the nursing homes. Quote, it was the single dumbest decision anyone could make if they wanted to kill people, said Daniel Arbini, who took his 88-year-old father out of a nursing home where over 50 people had already died. His father at least got to die at home with family, because remember, you're not allowed to go visit the nursing home patients, right? So it's always important that old people die by themselves. That's always good. So anyway, the order, by the way, I don't know. I get flustered when I talk about this because I'm just so angry about it, and I'm trying not to rant and rave too much on these video clips. But anyway, Cuomo reversed his decision on May 10th, but he says this didn't have anything to do with nursing home deaths, and the nursing home should have spoken up if there was a problem. Well, I read his order on March 25th, and it read, quote, no resident shall be denied readmission or admission to the nursing home solely based on confirmed or suspected COVID. So the nursing homes basically were told you can't deny anybody admission to your facility due to COVID. So I'm sure that's probably one of the reasons why the nursing homes didn't speak up. Now, the Society for Post-Acute and Long-Term Care Medicine had warned that Cuomo's policy constituted a clear and present danger to nursing home residents, and according to one of the members of the executive committee, the estimated deaths from this stupid policy were probably at around 5,000 people. And so this has just been all about great moments in public health. We can all be on top of each other at Walmart, but a shoe store owned by a sole proprietor, you don't want to go there. Dangerous, dangerous place. And we can all be in the grocery stores 2 feet, less than a foot apart, checking out on the self-checkout thing where we're all using the same keyboard, but you certainly don't want to let a clothing store open. Dangerous, dangerous place. I mean, and this brings me to the last thing I wanted to share with you today. And I think it's real typical of the stuff that I'm getting. And here, I'm just going to read it to you. I'm exhausted. This is not me talking, it's the person who wrote to me. I'm tired of the garbage on Facebook and mask shaming and self-righteous sanctimony spewed by every noodle out there who thinks they're right. And if you disagree, you're not only wrong, but dangerous. The 15-year-old son I've never met of people we knew during our seminary years killed himself the other evening at home. feet away from his pastor, father, and mother. No warning, their only child. He couldn't process the new normal and the constant drumbeat of negativity, the loss of everything a normal child needs in his life. Shame on us that we have allowed this to happen, that we have sat by complicit in the erosion of liberties and the decimation of our economy, that we've excused the behaviors that have left adults and children so bereft that suicide can happen right in their home, all because of the flu. There, I said it, the flu. Hate me, think I'm wrong, crazy conspiracy theorist, don't bother commenting. 2 can play at this. You cannot justify a total lack of compassion and empathy at this point while demanding compliance. Doors over there, see yourself out. I'm done defending myself. I'm done being castigated for daring to think differently. There is no tolerance, no discussion, no agree to disagree. In a world where the experts can't agree and have changed their stance 100 times, I'm wrong when I don't immediately buy the science du jour. And who pointed it out? My 15-year-old son, who spent 8 hours a day in his room on the internet doing school, not with friends, not at the rink, not at school. He said, when did it become only one thought process was acceptable? Never, Lex. It should never be that way. This person responds, I thought my charge was to protect my kids from a virus. The virus doesn't scare me anywhere near as much as the insidious darkness falling over society, where neighbors are tattling on each other, actually mad that other people are not living in fear, defying orders, embracing masks which makes everyone look angry and hide expression, furthering that feeling that everyone is suspicious and dangerous. I can't wear a mask, and the amazing thing I found is people are glad to see my face. They like to see my smile, they miss human contact, and they know they can converse with a maskless person because we aren't going to freak out. I haven't encountered a single cashier who wasn't delightful and pleasant, but when I appeared without mask. No, my charge is to protect my children from biblical levels of darkness falling. Their entire world has been damaged, and to believe that the love and protection of their parent is enough to save them is naive. Their world is far bigger than me, and it should be, but it has been taken from them, and there's no hope of being offered by anyone in authority that they will get it back. Nope, instead there's the constant drumbeat of new normal. That discourages me, and I've got the maturity and life experience to process it better than our children. So I'm not participating, I'm not excusing any of it, and I'm not playing the middle. I'm not trying to be balanced, I'm done. I refuse to sit by and just mourn from a distance, no less for a child who, despite being raised in the church by devoted and loving parents and showered with the love of Christ, was still so hopeless he was compelled to take his life at 15. Shove your mask, screw your fears. I'm done participating. I'll be in church, same row as ever, no mask, hugging all takers. I will not contribute to the darkness. Shame on us. Hard to read that. But I thought it was worth sharing because there are a lot of us who are just fed up with this. We see what is being done. We know what's happening to our society. They're turning against us. Go back and read some World War II history. Really, it's worth digging into. And I'll tell you to pay particular attention to Goebbels, who was the propaganda minister during World War II. He would be so proud of the media today. This is a better job than they ever did in Germany. And there's so many more of them that have to be controlled. There's much more limited media back in the days when the Germans were trying to control the narrative. Controlling this takes epic effort and a lot of money and a lot of influence. And Goebbels would be so proud of today's media. And I guess some people maybe want to ask themselves, is that what we're striving for? That we're doing as well as the Nazis and promoting a false narrative about what's going on? All right, well, that's probably enough for now. And still working on keeping it all together here in the midst of the disaster, being crystal clear that we're fine here. My concern is out there. All right, that's all for today. Pass this on to anybody who you think would benefit from hearing the truth about this, and I'll be back to you tomorrow with more news.